Everything is paid for through federal workers' comp. And they don't pay 95%. They pay 100%. So you don't pay any money. It's all taken care of by federal workers' comp, which is wonderful. And you're now able to get all that needed treatment for your wrist or any other part of your body and get better and still able to work.
Welcome to the Back to Work Melbourne podcast, where Dr. Dorfman is your federal workers' comp OWCP expert in Brevard County, Florida. In this podcast, you'll hear tips and tricks about the OWCP process, along with heartfelt patient testimonials from those we've helped get their claims approved. Tune in each week for insightful advice and inspiring stories that will guide you through your journey.
Lisa, how are you today?
I'm great. How are you?
I'm doing great. We're so happy that you're here on our podcast today. So tell me, Lisa, where do you live?
I live in Vero Beach, Florida.
Okay, so you're about an hour away.
Yes.
Okay. And I would assume you're treating with us because there's no other federal workers' comp people closer to you.
That's correct.
Federal workers' comp is like a specialty because doctors don't like to do a lot of paperwork. And with federal workers' comp, there's just a lot of paperwork. That's the reason why more doctors don't do federal workers' comp. But when you know how to do the paperwork, when you're trained in doing the paperwork, it's a little bit of a big deal, but we know how to do it successfully. And that's why you're here treating with us and today here for our podcast, because we unfortunately are the closest people to you, which is about an hour away.
Yes.
Okay.
Exactly.
But the great thing about federal workers' comp is you get your transportation reimbursed.
I do.
Okay. Have you been doing that?
I have.
Okay. It's simple. It's just it's just a form every month. We give you your list of dates, and then you just get all those dates reimbursed for your transportation.
Absolutely.
Nothing wrong with that. So tell me, what brought you to our office originally?
So what brought me to the office originally was I had been diagnosed with carpal tunnel, and my consultant, Mr. Larkin, sent me here because he was familiar with the injury center out in D.C.
Okay. And you work for?
The Environmental Protection Agency.
Okay. And what is your particular job?
I have been working in accounting for approximately the last 25 years. So
okay. And how long have you been working there at the EPA?
25 years.
Oh, really? Okay.
Yes.
So 25 years doing the same thing,
Yes.
whether it be a long time ago, it was pencils, but now it's all computers
It's
and
all
everything.
computer.
But it's just the same thing over and over again.
Yeah, it's repetitious, typing numbers all day.
Okay. How long do you think you've had the wrist pain? Or since?
I've had it for a long time.
Okay.
A very long time. So
What did you do about it originally when it was first starting to bother you?
I didn't do anything, and probably maybe about 3 years ago, I went to the doctor because he gave me a wrist brace, and told me to put ice on it, but they never said carpal tunnel.
Okay.
So
And at that point, a few years ago, you were using your health insurance?
I was.
Okay, so
Yes.
some type of out-of-pocket expense because our health insurance never
Yes.
pays for everything.
Yes.
Okay.
I had a copay.
And when did you learn that this is actually a work injury?
I was talking to a friend. She was telling me that she had carpal tunnel and she was going to an injury center out in D.C. And I said, that sounds like something that I have. And we're in the same line of work.
Mm-hmm.
She works for the Air Force. And I was like, oh, this may be related. And she put me in touch with Mr. Larkin.
Okay. A lot of people don't understand, and it's up to us to educate people. One of the reasons for this podcast, it's up to us to educate people that a federal work injury can be one of two things. It could be something that happens on one particular occasion. That's when you filled out that form that said CA1. If you injure yourself on one particular occasion, you're bending down to pick up a box, you're reaching above your head for something and you hear a tear in your shoulder, or something happens at work on one particular occasion, that's when you fill out a CA1. And that's what most people think is a work injury because you hurt yourself at work. There's no doubt about it. That's where you did it. But then there's so many millions of other people who have injured themselves at work, but over time. Use of pens and pencils, use of your computer, everything that you're doing just over time, looking at your computer monitor over to the right and causing neck pain over time, everything that you're doing that's causing pain over time. And so many people, they just think, that's just me. That's just me. I'm getting older. And even though I'm working all day and that's how it happened and that's how it continues to get worse, we just then use our health insurance to go to our doctors, get our therapy, maybe even get surgery, and all these things that come out of our pocket. But really, it's a work injury. And the great thing about federal workers' comp is they acknowledge that injury over time. Other than other forms of workers' comp, where if you don't hurt yourself on one particular occasion, you're done. With federal workers' comp, they acknowledge the work injury that has happened over time. And what you might not know, and what nobody knows, is you have over 3 years from the date that you found out that it was a work injury. So you could have injured yourself 6 years ago, 7 years ago, 8 years ago, and you're working with it, you're using your health insurance, you're in pain, your life is becoming a lower standard of living, and you're dealing with this pain, and then someone says to you, this is from work. At that point, that's when the clock is ticking. So now you have 3 years as of that particular time. Like when you spoke to someone, for example, or actually you have to speak to a doctor, not a coworker. When you speak to a physician and say to you, hey, that's from work. Now you have 3 years as of that date. So you could hurt yourself. The beginning of your pain could have been so long ago, but you get 3 years as of the date that you found out that this could be a federal work injury. And then you can begin treating. So now instead of using your health insurance and your co-pays and your deductibles and your co-insurance and everything that you pay for, and your medication, now everything is paid for through federal workers' comp. And they don't pay 95%. They pay 100%. So you don't pay any money. It's all taken care of by federal workers' comp, which is wonderful. And you're now able to get all that needed treatment for your wrist or any other part of your body and get better and still able to work. Are you working at this time?
I am.
Okay. The reason I ask you that is because we love our patients working. We don't ever want your employment to think that we're part of the problem. We don't want your employment to think, oh, federal injury centers, they just love to have people out of work and they just write you letters so you're not working. And then everyone gets to stay home and go to the doctor all the time. And the federal government has to pay for it. That's not what we try to do. We want all of our patients working. We don't want to be part of the problem. We want to be part of the solution. And we explain to the patient how important it is to work. And as long as we're able to treat you and maybe reduce your job responsibilities a little bit so you're not injuring yourself at work, we really try our best to keep people at work. So what kind of treatment are you getting here?
I am getting a massages on my hand, and they're doing work on my shoulders because this is my problem area too, is my shoulder. Of course, my neck from being in that position, working for so long. They're treating that, doing tractions and working with the physical therapist and the exercise person.
Okay.
So,
any other doctors that you're seeing? Have we referred you anywhere?
yes, I have been referred to neuroorthopedics as well as a doctor down in West Palm Beach that I'm going to start seeing soon.
The great part about federal workers' comp is as long as you're treating successfully, as long as you're treating on your care plan, we are able to refer you for whatever you need. If you need MRIs, X-rays, CT scans, whatever you need, it gets taken care of. If we need to refer you to other physicians so you can treat with them in addition to treating with us, we can do that. As long as the patient is treating correctly and showing to the Department of Labor that you are injured. And our documentation, as long as we're showing that you are injured. Another great thing about federal workers' comp, they pay for all the providers, and it's not a problem. And in other forms of workers' comp, there's always a problem. They're always denying the referral here, denying the referral there. They're always trying so hard to deny everything. With federal workers' comp, as long as you're treating, which you are, and as long as we're documenting your injury successfully, which we do, we're able to quickly get you on over for whatever testing we need to do. There's no delay, and we're able to get you to the orthopedic doctor if we need to. If you need surgery, and then we're able to see you again for the physical therapy. So the great thing about federal workers' comp is you're able to see all the physicians that you need to see, and it's done pretty quickly as long as we're doing our stuff quickly. I'm glad you're getting better.
Yes.
I'm glad you're at work because we really do try to keep all of our patients at work. Just keep getting better.
Yes, I was working this morning and I'm going back.
And then when
This
you're 100%
afternoon.
better, we'll do another podcast where you can say, now I'm all better.
I'll be here.
All right. Nice to see you.
Thank you.
All right.